Hello, and welcome to the Science on 7th live stream, a virtual space where we talk about topics related to air quality and health. I'm your host, Pallavi Pant. Today, April 7th, is World Health Day, a day where we get the opportunity to shine the spotlight on a topic related to our health. And, in this last few months, we've been seeing a lot of news about various ways in which air pollution is impacting people's health, different organ systems. In fact, I have a chart, if we can pull that up, that indicates all the different organ systems in our body that air pollution can impact. It goes all the way from our lungs and our heart to our brain, our reproductive system, bones and joints and skins. So we know that air pollution affects a variety of our organ systems. We are also just back from a global conference on air pollution and health, where there was a lot of discussion around how air pollution impacts health. What do we know about it? How are people getting impacted by it? And in all of that conversation, we often focus on non-communicable diseases, or NCDs, as you will hear me say. We know that about 90% of all deaths that occur as a result of air pollution exposures are due to non-communicable diseases. But in some parts of the world, there is also a connection between air pollution and infectious diseases. So I'm very excited today to be welcoming our guest, Jill Baumgartner, to talk about air pollution and infectious diseases, and in particular, tuberculosis. Jill is a professor and William Dawson Law Scholar in the Institute of Health and Social Policy and the Department of Epidemiology at McGill University. She's also the director of McGill Center for Climate Change and Health. And Jill has studied exposure to environmental pollutants and their impact on human health in many countries around the world for a long time now. And for the last several months, I've also had the pleasure of working with Jill directly through her advisory role in our HEI Global Initiatives Oversight Committee. Welcome, Jill. Really pleased to have you with us.
Thanks so much, Pallavi. It's really a pleasure to talk to you on this Monday morning.
Amazing. So I'm going to start with a broad question, as I usually do. Air pollution, we know, impacts a lot of organ systems in our bodies. We hear more and more about how it impacts our lungs and also our heart health, and a lot of other diseases which are really non-communicable diseases. But we know, and we have evidence for the fact that air pollution is also linked to infectious diseases. So if you were to summarize what we know about this relationship between air pollution and infectious diseases, what would that be?
Yeah, thanks for that question. The link between air pollution and infectious diseases, it's recognized as being important for a number of health outcomes. And I would say there's a few health outcomes that we're still kind of piecing it all together. So what we do know is that air pollution can increase susceptibility to infections. So things like air pollutants like particulate matter or PM 2.5 and ozone, when you're exposed to those, they can reduce your respiratory defenses, so they can affect your immune system, and they can make people more susceptible to infection. So we have decades of evidence showing that air pollution can increase risk of upper and lower respiratory infections. And this is something that's really important for child health because lower respiratory infections in particular are a really important cause of death for children under the age of 5. People exposed to higher levels of pollution, they tend to have worse outcomes after they're infected. So that means that they're more likely to be hospitalized. They have the illness for a longer period of time, and their risk of dying is a lot higher. And that's especially the case for people that are vulnerable. So the elderly, people with pre-existing conditions. And then if you're exposed to pollution over many, many years, this is also a concern. It can trigger things like chronic inflammation throughout the body. It can really throw off the immune system. And this can mean that, infectious diseases or respiratory infections, they can become kind of more serious or body-wide. And we saw this during the COVID pandemic, right? COVID was starting in the lungs, but it can start to affect your heart and other organs. So I think if we're going to kind of summarize what this all means together, it's that pollution doesn't just set the stage for getting sick or getting infectious diseases. It also really shapes how severe that illness is, both over the short and long term. So lots of links that happen both acutely and over time.
So clearly, a complex scenario, but I'm realizing that I should probably have started with a different question, which is, what is the distinction between what we call infectious diseases and non-communicable diseases? Because we launched right into how they impact and the connection with air pollution.
Yeah, that's a great place to start. So infectious diseases are caused by things like viruses or bacteria. They spread between people either directly or through vectors, things like mosquitoes or other vectors that can transfer infectious diseases, and they usually occur pretty quickly, so within days to weeks. Again, COVID-19 is a really good example of that is, I think, fresh in our minds. Tuberculosis is another example that we're going to be talking about today. And non-communicable diseases, the main distinction is that, they are not contagious. So things like heart disease, diabetes, cancer are things we would refer to as non-communicable diseases, or NCDs, often because communicable, if I start to say that 3 times, fast, I will mess it up. But so NCDs, they tend to develop over much, much longer periods of time, often years, and they're influenced by a number of factors. So you might be predisposed to certain NCDs because of genetics, but then there's also the impact of long-term exposures to different health behaviors, physical activity, smoking, alcohol, and environmental exposures like air pollution. I think the one thing I'll add here is that, we often treat infectious and NCDs as really like kind of 2 separate worlds. It's like different research programs, different training programs, different sides of healthcare. But I think the reality is that they're connected, right? You have infections can trigger chronic diseases. So, one example of that is hepatitis B and C. So hepatitis is an infection. It can lead to inflammation of and characterized by inflammation of the liver. And it's usually caused by a viral infection. But having hepatitis can also lead to liver cancer. So it can worsen your risk of chronic disease. Respiratory infections can increase or worsen chronic conditions like asthma or COPD and COPD. So, and it goes the other way too. So people who have chronic diseases are going to be more vulnerable to infections. So I think even though they have different causes, they're really intertwined. We tend not to think about it like that, but they really are.
Yeah, thank you for highlighting that piece in particular, because I feel like we do have this tendency, and I'll put myself in that category of saying, okay, like infectious disease and non-communicable diseases, and clearly they are connected. The risk factors are connected in some ways too.
Yeah.
So let's talk about the tuberculosis or TB. March 24th was World Tuberculosis Day. For those of you listening in who have not heard much about TB, it's an infectious disease which is caused by bacteria. So, an infectious disease which most often affects our lung health. And about a quarter of the world's population is estimated to have been infected with the TB bacteria. Just because you have the bacteria does not mean you're going to have the disease. About 5 to 10% of people who are infected with TB will eventually get symptoms and develop the disease. And, I'm from India, so at least 3 times in my life, when my cough was not getting diagnosed, I've been tested to see if I have TB, thankfully. That hasn't been the case. But TB is a disease, that affects really a lot of people around the world. In fact, we have a map, if we can pull that up, that shows how much is the mortality rate, how many people die because of TB around the world. And Jill, as we can see here, air pollution levels, we know, tend to be really high in parts of Asia and in Africa. And these clearly from this map, we see are places which have a high TB burden as well. So, do we know how air pollution interacts with the disease, how it can act as a risk factor?
Yeah, so I think as you just highlighted, it's a really big equity issue when we talk about TB and air pollution. So, as you were just pointing out, most of the deaths from tuberculosis, they happen in low and middle income countries, and many of those same regions have some of the highest levels of air pollution. And that's especially the case when it comes to household air pollution from cooking and heating with solid fuels, which is an area where I've done a lot of work. So we're starting to see more and more research pointing to a link between air pollution and tuberculosis, both in terms of your risk of infection, but also the greater chances of progressing to active TB disease. And I think we'll dig into that probably a little bit later. But I guess the one point that I want to make is that this overlap isn't just about air pollution and TB risk. So it's really also about the shared social and economic vulnerabilities that exist in the places where both of these burdens are large. So the same communities that are most exposed to air pollution, they also face challenges with TB prevention, TB diagnosis, TB treatment. And when we look at the kind of shared risks between the two, both TB and air pollution are tied to things like poverty, poor quality housing, limited access to healthcare. So, I think pollution may increase susceptibility to TB and risk, but I think it's really important to note that it's part of this much broader picture of social and environmental disadvantage.
Yeah, that's I think that always is a point that we need to keep in mind. And as you were describing this, I was also wondering, in some of these same regions, we also know that there is limited access to energy, oftentimes, or fuel poverty, and people may be using solid fuels for cooking, which have higher exposures. So, do we know anything about the relative contributions of ambient outdoor air pollution and household air pollution and how they intersect with the risk for TB?
Yeah. So the question of like how much burden is one that we're actively working with folks at the Institute for Health Metrics and Evaluation at the University of Washington on, like, right now. So I'll have much more specifics on that soon as we work on those burden estimates with them. But what I can talk about is kind of what we know broadly about this relationship between air pollution and tuberculosis. This is a subject that we just did a recent systematic review and meta-analysis on. So we just went through and kind of reviewed all of the literature on smoking and TB, ambient air pollution, and household air pollution and TB. And I think, really the strongest evidence on this kind of comes from tobacco smoking. So smoking more than doubles the risk of latent TB infection, and it also increases the risk of progression to active TB disease. And I think the other important piece of this for tobacco smoking is that it also worsens TB treatment outcomes. So you're more likely to have treatment failure and more likely to have early death even when treated with tobacco smoking. I would say the sort of the evidence linking air pollution and solid fuel use with TB, it's somewhat more mixed, but I would say generally suggests that exposure to both of those environmental pollutants can increase risk of contracting TB infection. So that's where we really have the strongest evidence. And there's lots of animal studies or toxicological studies that are showing that when you breathe in particulate matter, it penetrates deep into your lungs and the respiratory tract, and that can cause inflammation and worsen immune defenses. And that's sort of the mechanisms that are increasing vulnerability. And so, generally, I think we have good evidence that TB or air pollution is a risk factor for TB, both from these epidemiologic and animal studies. But in terms of the burden, your actual question, I'll be able to give you a much more concrete answer to that in a few months.
Fantastic. We'll be looking forward to it. And, hopefully we can also highlight it as part of State of Global Air. One thing that, as you were speaking, just struck me is that you talked about two parts of the TB issue. One is the latent infections or the active infections. And then the other part was like treatment and how well you might respond to it. And even from the COVID case, if we sort of look at it as an example, we know that exposure to air pollution or having lived in areas with higher pollution meant that people were at a higher risk of both getting the COVID, getting COVID-19
Yep.
and having more severe infections. The probability of dying was higher. So what's the story when it comes to TB and air pollution? And also, can you walk people through what is a latent infection versus an active infection?
Yeah. I mean, I'll start with the kind of first part of this, and keeping in mind my expertise is definitely more on air pollution than on TB. But essentially, when I'm talking about a latent TB infection, that is meaning that a person is infected with TB but doesn't yet have symptoms and isn't contagious, so can't actually spread it to others. So what that means is that the bacteria are inactive in the body, but they could become active later. And that's more likely to occur if the immune system is weakened. So remember a few seconds ago, I was saying that there's good evidence from toxicological studies showing that the immune system is impacted by air pollution. And that kind of gives a sense of what that link is, right? So if you have active TB infection, the bacteria more likely to become activated with a weakened immune system. You can see how that progression might be impacted by air pollution. And then when we have what's called active TB disease, this is when the bacteria are multiplying and causing illness. So people that have active TB, especially in the lungs, they can spread it to others through airborne droplets when they cough or sneeze or even in talking. And so this is where when we're particularly concerned about treatment for both latent and active TB, but especially when it comes to active TB. So there are drugs that can treat this and kill the bacteria that's responsible for both latent and active TB. On your first question, so in terms of what we know about the sort of from the science on air pollution and TB. So as I was mentioning, there's really, really good evidence on incidence. So just whether or not a person is infected with TB and the development of active TB. But I would say where we're really needing a bit more on the research side is sort of, if you have active TB, are you more likely to infect another person if that person is exposed to air pollution? So I think household contacts is an important area. Certainly the treatment outcomes, we don't have as much evidence as we do for something like smoking. So if you think about active TB disease and treatment, are you more or less likely to be treated and have your TB successfully treated if you're also exposed to air pollution? So I think there's a lot to be done on the outcome side of things, but where we have the most solid evidence is really on that link between air pollution and incidence of TB infection.
Great. You started answering my next question already, which is, it looks like we know that there is a link between exposure to air pollution and TB, that it also is sort of, perhaps situated within a larger, more complex set of risk factors and also the socioeconomic vulnerabilities that people might have. Are there any particular questions besides the one you just talked about that would benefit from more research or more science when it comes to understanding this disease?
Yeah, this is, I mean, as a scientist, this is always one of my favorite questions because we always need more. But again, having just reviewed the evidence on this, I can talk about a few things that came up in our paper. So I think the first is that there's definitely a need for longitudinal studies, so studies where they follow large populations over time, and that could try to get at some of those both incidents, but also TB treatment outcomes, like I was just talking about. There's also a need for region-specific studies, especially in places that have higher TB burden. So most of the existing studies are from China, and I would say there's really limited representation from places like Sub-Saharan Africa and South Asia, which are obviously, I think, as you pointed out at the beginning with the map, are really critically high TB burden regions. We also don't have a lot of evidence coming from air pollution and childhood tuberculosis. And this is a really important gap just because TB is of such great concern when it comes to children. So children tend to have a much higher mortality rate. There's some diagnostic challenges because children often they present with very non-specific symptoms. And so this is a really important gap to understand what that relationship looks like in children. Is it larger? Is it smaller? Should this really be a priority area when we're thinking about prevention or thinking about that air pollution and TB prevention kind of link? And I think, the other things that I've talked about a little bit on treatment outcomes and sort of that transition between infected to uninfected to infected, and then from infected to TB disease. I think that would be really important research in a longitudinal study to better get at mechanisms. So I think there's, we know a lot. We certainly know enough to take action, but I think there's both sort of thinking about the populations where the research is done, so focusing on kids, focusing on South Asia and Sub-Saharan Africa, and also trying to better understand those mechanisms would be really important priority areas.
Great. I hope some of the researchers are also taking notes as they're hearing this, because that's a very clear list of where we need more evidence and science. And to me, it is also interesting because there's diseases like COPD, for instance, or the chronic obstructive pulmonary disorder, which we know once a person has it, it cannot be cured. You're going to have to manage it for the rest of your life in different ways. But we know that TB is a disease which can be cured and can be prevented. In fact, I don't know if you've followed this at all, but John Green, who wrote the novel The Fault in Our Stars and other things, has been working on TB for the last 5 years and is, actively trying to promote ways in which the TB burden can be brought down. So hopefully, we continue to think about the issue in terms of not just from an air pollution lens, but in general. But I think air pollution can provide one way of thinking about it. So the other thing I'm thinking about is, okay, we know what we know, and it is that there is definitely a link between air pollution and TB, and that also the burden is highest in some regions. What can countries be thinking about? Is there things that countries could think about in terms of their policies? You mentioned not just the air pollution exposure piece or the TB treatment piece, but also the surrounding environment that people might be experiencing, the vulnerabilities that they may have. And this also puts a strain on the healthcare systems. People need to get treatment. So are there ways in which countries could be thinking about this differently or better?
Yeah, I mean, I think you pointed this out already really nicely, in that if we think, again, this is about sort of air pollution and TB, and I think treatment can happen on sort of either and. Well, it's the yes and, right? Like, so we need to address air pollution, and we also need to improve TB diagnostics, treatment, all of these other important things related to sort of the healthcare side of things. So there's no like one size fits all answer. And I think the kind of good news here is that countries have a lot of different strategies that are at their fingertips. So I mean, an area that I know you and I have talked a lot about and that I've worked on is on the household side. So if we think about shifting to cleaner cooking and heating options, so moving from biomass and coal to fuels like LPG or electric stoves, that can dramatically cut levels of air pollution inside homes. But, given that poverty is such a big driver of this, like, we need investments in electricity access. We need updates to power grids. We need to support systems like microloans and subsidies and local manufacturing to try and make these cleaner fuel options like truly accessible to poor populations, right? Those are the predominant users of solid fuels. Similarly, on ambient air pollution, we know that there are lots of different solutions that are successful and can be successful in reducing levels of outdoor air pollution. Transit, industrial emissions standards, improving waste management so that you have less trash burning. Those can all have a really big impact. And I think you wouldn't necessarily think about those as being like the key kind of TB reduction interventions, but they're part of that picture, right? So I think those are important to consider in addition to just, strengthening detection and treatment systems, addressing root causes like poverty and malnutrition. Those are all really important as part of this as well. So I think, there's a real opportunity here, but it really involves multiple sectors, multiple disciplines to try to come together and address this in multiple ways. It's not just a technical fix, right? It's about building communities that are healthier and more equitable and from an air pollution standpoint also more climate resilience, and all of that has to come together to make this all work.
Yeah, I'm not surprised at all to see you mention, multi-sectoral, integrated approaches, which seems to be, the way that a lot of these problems need to be looked at and addressed.
Yeah.
So I'm going to switch gears a little bit. I know that you have worked on this topic for a long time, and one of the most fascinating things for me as a host of this live stream is just learning about people's journeys. So if you can, talk us through a little bit about how did it start? Why air pollution? Why the focus on, some of these particular issues, including household air pollution? What did that look like over the years for you?
Yeah. So I got into air pollution in part. I was working on clean water and issues around waterborne disease and illness, and I was doing some field work in northwestern Yunnan in China, and as part of that sort of setup for my PhD research, I started chatting with various organizations and government officials that were working in the region, and air pollution was just something that continually came up, and so I shifted from water to air pollution in large part because that's what governments and some of the community-based organizations, they wanted to understand what the levels of pollution were, particularly in homes where they were using biomass and wood for cooking and for heating. And they wanted to sort of understand what those health impacts might be. So that was entirely how I ended up moving into air pollution. I mean, I thought the measurement from like a science standpoint, the measurement part was really interesting and challenging. And so that was exciting from like the kind of like nerdy science side of things. And then I also just generally liked how air pollution allowed you to work across disciplines to solve problems. Like I liked that I was collaborating with engineers, with other health scientists, with folks who were, working in across different sectors, and like I was mentioning, in government and civil society, but also more on the technology side of things. So that was kind of where I started, and then I think since then I've continued to work a lot in understanding what the health impacts of household air pollution are, but really moved more into what are the impacts of solutions. So we've evaluated different types of interventions, everything from like NGO implemented clean cook stoves to a major policy evaluation in Beijing, where they, in millions of households, they banned coal and provided major subsidies for electric heat pumps. So we looked at what were the health and air pollution benefits of those. And I guess the other piece of it has been really thinking about it in cities in low and middle. We know lots and lots about air pollution in high income countries, right? And I think we have great measurements. I think in Canada for a long time, we had more ambient air pollution monitors just in the city of Montreal than existed in all of sub-Saharan Africa. And so we have great measurements in North America, which has relatively low levels of pollution. I think in places that have high levels of pollution, we know a lot less, particularly at sort of the community level. So a lot of my more recent work has been working with local partners to put monitors across all of the cities. So taking advantage of low-cost sensors, but in combination with reference quality monitors to really understand, what does the variability look like across the city? What are some of the important local source contributors to air pollution? And then we can communicate with folks in government to say, look, this particularly part of your city, this has really high levels of air pollution. This is probably from industrial emissions, right? Or this area is a really vulnerable area. It's a low-income population and has some of the highest levels of air pollution that exist across the city. So this would be another place to prioritize. So that's kind of the work that we do on the measurement side, or that my group does on the measurement, and then also working on health outcomes. So as I was mentioning, thinking about things like the systematic review and meta-analysis that we've been recently working on with air pollution and tuberculosis, looking at cardiovascular outcomes related to air pollution. So it's really just trying to understand that picture, but really focusing on places in the world where we know the least, and that tends to be places in low and middle income countries.
Well, I'm really grateful that you were talking to people on the ground during your PhD and you made that pivot, because that really is how I like to see science in response to what the biggest questions are in any particular community. And also that, you're continuing to think about ways in which we can broaden measurements and continue to make data available that can be used to make decisions and hopefully clean the air. So as we come to a close, my final question, and a less than 1 minute response from you if you can, is what's the one thing that's giving you hope that we're working towards that idea of clean air for all?
Yeah, it's funny. You told me this question in advance, and I think it's the one that I thought about a lot, just because I think with everything going on in the world right now, we probably all need to pause and ask ourselves where we're like drawing hope from. And I think, at least for me, I get to go into work at McGill University every day, and I'm surrounded by these really bright, thoughtful, and I mean, honestly, passionate students from all over the world. And I think my day-to-day interactions with them give me a lot of hope. And I that's not something I say lightly. So I think, students, they bring this energy and a curiosity, and it's kind of this like fresh thinking into our research spaces. They ask me hard questions. I always have to say, like, just a second, let me look into that, or let me go home and do a little bit more research. They challenge me to think differently. They're pushing for change. And so I think, honestly, those day-to-day interactions are what is my biggest source of hope right now. And I'm really fortunate because I get it every single day, which is really great.
That's fantastic. Thank you so much, Jill. I think, this has been fascinating, not just from the point of view of learning more about air pollution and TB, which clearly what I'm taking from this conversation is that we do know there is a link, but there's still some missing gaps, especially when it comes to air pollution and childhood TB. But also that, doing the science in a way that is responsive to the local questions can really help, bring progress. So thank you for doing that. And, thank you also for your ongoing work on a whole range of topics related to air pollution. We look forward to what you're going to do next. So thanks again for taking the time to join us on this Monday morning. And everyone listening in, thank you very much. We're going to be back on May 7th with a very special episode where we will be hearing from Dr. Doug Dockery, who's one of the leading lights when it comes to air pollution. He's done some of the seminal studies on air pollution and health that helped us understand why we feel sick when we're exposed to air pollution. How does it happen? So please join in. And in the meantime, check out our previous episodes. Stay well. We'll see you on May 7th. And Jill, thank you once again. Thanks a lot.
Thanks so much, Pallavi.